Coming to you live on location today from Daytona Beach, Florida, at the office of
Dr. Song, an oral surgeon back home to make a difference.
Dr. Song.
Dr. Sam Song. What point did you decide you wanted to pursue dentistry?
Oral surgery was like, that was it.
When you say trauma.
One lady had a kitchen knife stuck through her face.
Ooh.
And that was like my second week being an intern.
And why did you decide to move back to the Daytona area?
The main thing that brought me back was family. This has always been home.
I was down, but now I'm
You're tuned into the EG Dominates podcast, coming to you live on location today from Daytona Beach, Florida, at the office of Dr. Sam Song. Welcome to the EG Dominates podcast.
Thank you.
Glad to have you.
Yeah.
Dr. Song works with Florida Oral and Facial Surgery Associates, and they have an office in Daytona Beach, as well as a second location
In Palm Coast.
Yep. And we've known each other for about 2 months.
Yeah.
And I'm excited to hear your story because you're from this area, and you don't oftentimes see or hear of somebody that grows up and goes away to school and comes back to the hometown that they grew up in. So it's cool, and I'm sure you've seen this area change so much in the last 20 years.
Oh yeah, there's so many. Like, I don't even recognize it sometimes anymore. Like, when I first moved back, I was like, I didn't even know they were like developing this much. Like, there's so many new houses. There's like, different restaurants that, I never even thought were gonna be here.
Yeah.
So it's like, it's pretty crazy, but I'm glad to be back. Honestly, like this has always been home. Even, like during the summers in college, or even when I got a break during dental school, or even in residency, I would come back here because all my family's here. Mm-hmm. This is my roots.
So let's start from the beginning, right? So born and raised in the Daytona area, mm-hmm. right? And we're talking about a time when you probably stayed out late, didn't have cell phones and GPS trackers, where your parents knew where you were. What's it like growing up in Daytona Beach?
It's pretty unique, like my parents really wanted to stay in this area for the school district because, I graduated from Spruce Creek, and they have a IB program, or International Baccalaureate program. Okay. And so like that was a huge plus for them, for my brother and I to go through, because it really prepares you for college and all that. So that was their main objective, right? They want their kids to succeed. So they wanted to stick around this area, but it's pretty unique in the sense that like you can pretty much do what you want to do around here. Mm-hmm. There's plenty of places to shop at, but also like you have the beach right here. I grew up surfing, playing baseball. Some of the best athletes that I know came from this area, and I got to play under. I've had the honor to play under some of the top coaches in the whole state.
No kidding. So you were a baseball player growing up?
Mm-hmm. Yeah,
okay.
Yeah.
What position?
Growing up, I always played second base and shortstop, just because my stature.
Yeah. So did you play? You played for the high school team then?
Yeah. Okay. Played high school, and then moved on to play in college.
Oh, you did?
Yeah.
Okay.
Yeah.
So we'll get to the college part. But
yeah.
Okay. So that's exciting. So played baseball in high school, but also you said you spent a lot of time surfing.
Yeah.
I grew up in Southern California, and we're talking off camera, but I grew up surfing as well. And the beaches in Southern California are obviously a lot different than the beaches in Florida. And for all my California cohorts and friends, they think that California beaches are like the best. And they're okay. Yeah. They're good. But one of the things that's so nice about the Florida beaches is the water is so warm.
Oh yeah.
You always have to have a wetsuit in California.
Yeah.
Out here, the water is, 85, 90 degrees. What are the waves like? What are the sets like? Where are some of the places you surf in the area?
I mainly grew up surfing the inlet, in Ponce Inlet. It depends on the day. Most of the time the inlet has like good, like rolling sets. It sometimes barrels on the inside, but it's a nice place to grow up surfing and kind of, catch your roots.
Mm-hmm.
It's not super intense unless like, you go out there during a big hurricane swell.
Have you done that before?
Yeah,
You have?
yeah. When I was in high school,
So what's that like?
it's pretty intense. Sometimes like you'd wipe out and you get held under and you're like, oh my gosh,
How
today's
big
the
are
day.
waves?
Biggest I've paddled out, it was like a 8 to 9 foot day. Yeah.
Wow.
Yeah.
Here?
Yeah.
Okay, so hurricane offshore,
Yeah.
a couple of days out, makes
Yeah.
for some good waves.
Yeah.
Wow.
But a lot of the only problem is a lot of big days around here can be really choppy too, So,
I just feel like I've surfed twice in Florida since we've lived here. And the thing that's hard is both times it was like there was no relief. It was like one set after another.
Mhm.
You know what I mean? So you're constantly just fighting waves to get out there.
Mhm.
I had a hard time mastering that because I'm not used to that in California.
Yeah, because it gets pretty washed out when it's bigger. But some of the best swells that come in, like on this coast of Florida, they're really like ground swells from earthquakes off the coast of like Africa, and it moves across. And it's not huge, but it's really fun. It's really fun.
So love surfing. Do you still surf to this day?
Yeah. I ever since I moved back, I just started picking it back up again, and I recently got a board.
Okay. So this is what we need to be doing. You're
Yeah.
playing music like golf. I don't golf. Surf. We need to surf.
Yeah, let's go out. Let's paddle out.
All right.
For sure.
We're okay. That's a date.
Yeah.
That's a date. Okay. So growing up in this area, great experience. I know you said you have a brother. What was life like? At your house. Were your parents really strict, or were they, into sports? Like, what was the structure?
They were very strict. They gave me a lot of discipline and structure to my life. But
That's a good thing, though.
yeah,
Yeah.
of course. It kept me out of trouble
Mm-hmm.
for the most part.
Well, look where you are now.
Yeah.
You know.
Yeah. But yeah, sports was a big part of both my brother and I's lives.
Okay.
Since we were like very, very young, my mom put us into like tennis, put us into baseball, put us in like my brother didn't, but I did taekwondo and I like competed at the national level.
Dang.
Yeah.
Okay, so you're a super competitive guy.
Yes.
That's what I'm gathering here.
And my brother's 8 years older than me, so like that was like a huge drive. Like he always whooped my butt in tennis. So I was like, that was like my goal was to one day beat him.
8 years. That's a pretty big
Yeah.
age gap.
Yeah.
I have a brother who's 7 years younger than me.
Mm-hmm.
So I know what you're talking about from that competitive standpoint because we both played basketball. I played basketball in college. And so growing up, even though there was a pretty significant age gap, we were very competitive with each other.
Yeah.
Yeah. So favorite subjects in school?
I mean, biology was naturally like my favorite subject. It was just so interesting.
Okay.
Just it's the study of life. It's and that kind of just, I guess, funneled me into what I wanted to do, pretty much. Cause like
So when you graduated high school, so you said you played college baseball. Were you looking for a specific college that you wanted to go to, or were you kind of waiting to see what your options were from a scholarship standpoint?
It was more of the latter. Like it was pretty random. I went to a small D2 school in South Carolina.
Okay.
It's called Coker University.
Okay.
Never heard of them until like I got a call from the coach, and like they said they were interested in me. They saw me play,
Okay.
and so you know, that was a great opportunity. Like I went up there, went on a visit, did a little workout for them, and he like led me on a tour through the campus, and it was just beautiful. It was just like, you know, very
big trees and
big,
like brick
yeah,
building kind of vibe.
big trees, brick building, all the columns and pillars.
Yeah.
Very like colonial,
Mm-hmm.
like just like that old like college feel.
Yeah.
You know, and I was like, yeah, this might be the place. And I got to meet the science department, like the head of biology and all that, and you know, they really like reeled me in. I was like, yeah, I feel comfortable coming here.
That's cool. So how far away is that drive? Is that a drive, or do you have to fly?
Oh, I drove. It's about like 6.5 hours.
So 6. And what was the name of the school again?
Coker University.
Coker
Yeah.
University. Okay.
Yeah.
So we go to school at Coker University, play baseball.
I don't want to interrupt you. You can't be chewing gum.
Oh, sorry.
Don't worry. Because
Okay.
it's gonna be coming out. Yeah. There you go.
All right. I'll just put it in my pocket.
Thanks.
Here, guys.
Um,
Yeah. Sorry, I was looking at that thing for a while and I was like, oh, you can't be chewing gum right now. I was like, well, that's just not
Good call. Good catch. So at what point did you decide in undergrad that you wanted to pursue dentistry?
I really didn't have a great idea until like probably my junior year in college.
Okay.
Because I always knew I wanted to be in the, you know, medical field, but I didn't know exactly what.
Okay.
I was kind of torn between, you know, med school and dental school. I knew I didn't want to go into research for a PhD because it just didn't really suit me. So what really got me like lined into dentistry was just my brother as an example. I started shadowing him, and
That's right. You said your brother is a dentist
Yep.
in Orlando,
Mhm.
right?
Mhm.
Okay. What's his name again?
Benjamin.
Ben Song. Dr.
Yeah.
Ben Song in Orlando.
Yeah.
I'm coming for you. Okay.
So I started shadowing him because I was like, I don't really know what I want to do. And you know, he was an Air Force dentist at that time. He was based at Patrick Air Force Base.
Oh, cool. Okay.
And so I started shadowing him, kind of getting the feel of what dentistry is, and I was like, oh, this is really cool. Like, I feel like I could do this. You know, you get to work with your hands all day, like, you know, interact with people. And then he's like, oh, I'm great. I'm glad you like it. Let me have you shadow some of the specialists that I refer out to. And then out of all the specialties, oral surgery was like, that was it. I was like, I got hooked.
So what was it about oral surgery compared to the other specialties?
Just the excitement of it. You know, at that time, you know, I was just a young college kid. I was like, this is really exciting. I feel like I would never get bored.
Mm-hmm.
And it's challenging. And again, that competitiveness in me, like that drove me to like wanting to go into a challenging field.
Yeah.
And so when I started shadowing the oral surgeon, I was like, you know, I think I can do this for the rest of my life.
Who did you shadow?
Dr. Burns.
Oh, down in Melbourne.
In Melbourne, yeah.
Mm-hmm.
Yeah. But, you know, ortho, I thought I wanted to do orthodontics, but it just wasn't for me, you know?
Yeah, I mean, you can't compare. You can't even compare
Yeah.
the two. I've
Yeah.
worked in both areas, and yeah, it's a totally different vibe.
Yeah, it's just a totally different pace of your day.
Yep.
And, you know, some of my best friends are orthodontists. Like, it's such a cool field.
Mhm.
And, like, just, like, all the planning that goes behind it is, like, really intricate, but it just didn't suit me. And
Technology has really changed.
yeah,
The orthodontic profession in the last 10, 15 years with the 3D scanners and clear aligners and the software planning and
Yeah.
treatment planning systems that they have in place now. Like I couldn't imagine being an orthodontist like in the 80s or 90s compared to now. Like,
Oh, yeah.
it's like the whole profession
yeah.
has totally changed.
I mean, even surgeons from the 80s and 90s compared to now.
So talk to me about that. What do you think? What do you think the biggest differences are? Like what are things that you use day in and day out now that they didn't have back then?
Just like a lot of 3D planning.
Okay.
Yeah, like in the end, when you're operating, you go back to the basics and the principles of surgery. But planning wise, just all the 3D planning that's available nowadays with technology and like I don't use it as much now, but the option to 3D print things and make surgical guides, or I've even 3D printed things and bent plates for reconstruction for it.
Really? Wow.
Yeah.
Okay. Like what?
Like a big like a mandibular reconstruction plate.
Wow.
Instead of being intraoperative and trying to freehand the bends to like create the right contours. You can literally print the non-affected side, mirror it, and have it match the affected side, and bend a plate around it.
Isn't that crazy?
Yeah.
Insane.
It saves so much time.
Yeah.
Too.
Yeah. That's a big one. So back to college. So you knew early on that you wanted to be an oral surgeon before you even really became a dentist,
Yeah.
right? But I've seen that happen. I don't know. I feel like I see and hear more doctors say they became dentists and then decided, usually after like a year or two of practicing, that they wanted to become a specialist in oral surgery. But you kind of did the opposite route.
Yeah, I tried to keep an open mind while I was in dental school. I was like, what, like, I don't know yet, right? But
So graduate from undergrad, and where did you go to dental school after that? So
I went to Tufts University up in Boston.
okay, so
Yeah.
Tufts up in Boston, and how many years were you up there?
4 years.
Okay,
Yeah.
and that's a cool experience. Boston's such a cool town,
Yeah.
and it's so different than here,
Yeah.
right?
Yeah.
So you're in Boston for 4 years. Anything stick out in your mind from that time that kind of shaped kind of how you became a doctor?
Well, not really like the school. I mean, I had a lot of really great mentors, but some of the most like memorable times was just being in that city during the Red Sox World Series win in 2018.
Oh yeah.
And then the Patriots winning twice.
Oh man.
And
That's
so
right.
like being immersed in that like city during those times with all the parades and everything was like crazy.
Now, did you live in the city? Were you in? Okay, so
Yeah.
you were like front and center for all the action. That's
Yeah.
such a great town.
I could see the Boston Commons from my window.
Oh wow.
Yeah.
Wow.
Yeah.
So you really kind of like you moved around. You experienced some cool places. So you're at Tufts for 4 years. You graduate, and then what happens next?
So right out of dental school, I applied for oral surgery residencies. I didn't match right out of dental school.
Why?
I don't know. Sometimes good candidates fall through the cracks. Maybe that year I just didn't really interview well. Unsure, because I on paper I used this. I never retook any exams. Like I used the same scores. You know, I still had the same GPA, right? Like everything was the same, but I ended up matching the second time.
Do you feel like you matured? Like, do you feel like in your mind that there's a certain time, like a certain time point where grades and stuff like that aside, you kind of just became comfortable and confident with who you are as a person?
Most certainly. Yeah, I you know, at the time when I found out I didn't match, it was devastating, right? It was a huge blow.
Yeah. Especially if you're that competitive as well, right?
Yeah. And so, you know, I decided to do a oral surgery internship at Emory University.
Okay.
So I lived in Atlanta for a year. And during that time, it was hard. It was tough. It's a tough program.
How long is it?
You're only contracted for a year.
Okay.
So essentially, you're a year one resident. You're treated as a year one resident, but it doesn't go towards
Anything.
You're
It just looks good on paper, right? It helps you to get your foot in the door somewhere.
Yeah, it shows
How did you even
dedication.
hear about that program?
I externed there while I was in dental school, and
Okay.
and there was a few of Tufts alumni that went there for their residency,
Okay.
and so I knew of them. I mean, Emory's a pretty big name,
Yeah.
so I was like, you know, if I'm going to continue to pursue this career, I'm going to immerse myself in, you know, one of the most challenging programs. And so that's why I decided to go there. I mean,
So basically, like if you're not in dental or medical, what you in a sense did was an unpaid internship for 1 year.
it was still paid.
Okay, so you did a paid internship for 1 year,
Mm-hmm.
but that gave you the experience that you needed to get into the program.
Yeah, I would say it really showed me how much I wanted it.
Okay. So
Even-
what kind of what kind of things did you get exposure to and do during that first year?
Well, I would say I got a lot of exposure to trauma.
Mm-hmm.
You know, they cover Grady Hospital, which is, I think, was rated like the third busiest trauma center in the whole nation.
Really?
Yeah.
Wow. Okay. This
So
is up in Atlanta.
mhm.
Okay.
So, you know, sleepless nights there when I'm, you know, just a shell of a person sometimes.
When you say trauma, give us some examples. Like what does that entail?
Just kind of like pan facial fractures, people just busting their face through a windshield or on a steering wheel.
Mm-hmm.
We get like a lot of, you know, just blunt force trauma from violence, like fists.
Okay.
One of my most memorable ones was, or two of my most memorable ones was, one lady had a kitchen knife stuck through her face.
Ooh.
And that was like probably my second week of being an intern.
Wow. Okay.
And I was on call and I walk in, I was like, oh my gosh. Going from dental school and like just seeing this, I was pretty flabbergasted. And then the other one that kind of hit home to me was this guy. He got pistol whipped. He was locked in his basement by his roommates for days and got pistol whipped in the face every day until he gave them the code to his safe.
Oh my gosh.
Yeah. And helping reconstruct this gentleman and seeing how thankful he was really really showed me like this is why I do what I do.
Yeah.
Like that hit home for me.
Yeah.
Yeah.
That's and that's a story. Like that right there is a definitive moment in your timeline that you will remember forever.
Yeah, for sure. Like I wouldn't say it was the defining moment, but moments like that, like the countless ones that I can't recall off the top of my head, really showed me like, okay, like this is
You
really
made the right choice.
Yeah. This is really why I want to do what I do. And that year, no matter how hard it was, it like I wouldn't have traded it for any other experience in the world, because it really truly was a blessing in disguise.
Mm-hmm.
Like the sleepless nights, the next day in clinic when I'm just exhausted,
Mm-hmm.
I wouldn't trade it for anything else, because it really showed me how much I really wanted to do this. It also kind of...
Well, it sounds like too, Doc, it gave you some good experience and set you up, because I know that you are actually one of the oral surgeons that is on call at the hospital here in Daytona, right?
Yeah.
At Halifax?
Mm-hmm.
Yeah. So how did that experience kind of help you with what you do now?
It just made me very comfortable with
Confident.
yeah, just I feel very confident going in. You know, there's not much that I don't think there's really much that I don't think I can handle.
Mm-hmm.
You know, so
You've been exposed to a lot of variety of different types of trauma cases and anything else that would potentially come your way.
Yeah.
So after this program that you're at Emory, you leave there, and where do you go next?
So as I was an intern there, I reapplied, and I ended up matching at Denver Health Medical Center.
Okay. And this is now what year? What year?
It was 2020.
Okay.
Yep.
Ooh. Wow.
Yep.
So did you get accepted and moved out there before COVID or after?
It was right in the midst of it.
Okay.
Yeah. It was a weird time to move.
Yeah, I bet.
Yeah.
Well, I think if there was ever a time to be on the roads driving cross country, that was probably a good time for it to be, right?
Yeah, it was.
Yeah. Okay, so you get out to Denver, which is also an incredible place. I love the mountains out there.
Oh yeah.
Yeah. So what was the program like in Colorado?
So again, it was just another, or it was another like trauma heavy program.
Okay.
Denver Health is like the main, like it's the main level 1 trauma center in like the whole Rocky Mountain region, and it felt very comfortable to me. Like it was very familiar. So from then on, it was just getting reps in, you know, continuing to like sharpen my skills, and graduated.
So that's a 2-year program?
It's a
3.
4-year program.
Okay, so 4 years. So 4 years. Okay, so you spent a lot of time in Colorado. So you're for 4 years up there. So graduate from Colorado. Now we're going to get to the good stuff. Okay, you graduate. How did you decide, and why did you decide to move back to the Daytona area?
The main thing that brought me back was family.
Yeah.
Yeah, all my family's still here, and you know, I was thinking, you know, my wife and I were like, well, if we're thinking about starting our own family, it's really nice to have a good support group, and it was just easy. It was easy to come back. Also, you know, it's a great place to raise children.
It is.
Yeah. So that was a huge factor.
There's so much to do here. I don't want anyone else to move here, right? So if you're watching this and you don't live in Florida, like it sucks, really. This is not a good place to be. It's horrible. No, I love, there's nowhere else I'd rather live. And I've lived in quite a few places. And my wife feels the same way. And we were really lucky to have the opportunity to move out here when we did, because we were just starting our family, to your point. And I look at, you know, that was 15 years ago. So now I have a 15-year-old and twins that are about to be 13. And I think of all the cool things that we do in Florida on a regular basis. What are some things? Right now, it's just you and your wife. You know what they call that? They call that you have a specific name.
Dinks.
You're a dink. Yeah. I wish I was a dink again. Oh man. So you're a dink as well. Double income, no kids. What do you guys like to do for fun when you're not working?
Well, like whenever we get free time.
Like I'm like super interested in knowing this because I'm like want to live vicariously through what you're gonna say because like I'm ready for the kids to like go to college, so I can be on the back end of it and enjoy just my wife and I, you know, with no responsibility. So what does it look like?
So she loves the beach.
Okay.
So we'll she loves the beach. So we'll like pack up the truck and like you know, put some chairs in the back. I'll bring my board.
Okay.
She'll hang out on the beach and then I'll go surf.
Okay, so
Yeah.
that's something you guys do a couple of times a month?
Yeah.
Usually morning or evening?
Probably like morning into the afternoon, and then you know, when the afternoon storms start rolling in, we pack it in, and we like to go eat around here, or you know, try to find like new places in Orlando.
So what beach do you go to? What's your beach?
We usually go to Ponce Inlet.
Okay, so all the time Ponce Inlet. That's your spot.
That's home for me.
Okay.
Yeah.
So if you paddle out in Ponce Inlet and you see Dr. Song, you know, you can say hi to him. What else do you guys like to do besides that? You guys had a chance to like do you like to fish or do you like the?
I loved fishing growing up. I haven't really been like getting back into it.
Okay.
Yeah.
How about the different springs? Like, have you been to Devil's Den or like Silver Springs in Ocala?
That's on our list. We want to start doing that. We've been to Wekiva Springs.
Yeah, that's nice.
But we definitely want to go around the different springs in the Central Florida area. I've been there as a child. You know, I've been to Blue Springs, Glen Springs, and
Gotta take your wife to Silver Springs, man.
yeah, I need to. Yeah.
So you know Silver Springs. I probably have gone and kayak there probably 25 times.
Really?
They apparently, like, I think as the story goes, I don't know if I have this right, so I'm going to try to piece it together. But I had heard the story that they had shot a Tarzan movie in the 70s in that Ocala National Forest area. And somehow, some way, the monkeys either got released or they escaped. But to this day, there are now like hundreds of monkeys that are in the Ocala National Forest.
Yeah.
And if you go to Silver Springs, you can, you know, kayak or wherever, and a lot of times you'll see them in the trees, like running through, and I've seen it several times. It's incredible. It's like unlike anything you'll ever. It's like you feel like you're at the Amazon. Is what it feels like. It's awesome. Yeah. So that's a good one. That's a good one.
We gotta check that out for sure.
So you decide I want to move back to Daytona. There's a handful of oral surgery groups in this area. So tell me about your experience and how you ended up with Florida Oral and Facial.
Well, I when I was looking to move back, I knew this practice just growing up. They were the main guys in this area, and when I shot out emails inquiring about, you know, any openings for a surgeon, they were the first to email back. Like it was like next day. So whenever I got such a quick response, we set up an interview. I was still in Denver. We flew back, stayed with my parents and my cousin, and then interviewed here, and I fell in love with the place. You know, it's so unique.
So tell us about it. If I'm somebody that lives in the Daytona area and I happen to see this podcast episode, what makes Florida Oral and Facial different than the other options that are out there? In your opinion, because you're a doctor, obviously, working for the practice, but
For me, it was the scope of practice that they offer here. It's not just wisdom teeth and titanium and bone grafts. We take facial trauma call here at Halifax. I think we're the only facial trauma surgeons in the Evolution Flagler area.
That's a unique advantage.
Yep.
Mm-hmm.
And just like the ability to practice the way you want to. We have two ORs in the back, to where if I want to do an arthroscopy, I can take a patient back there. We have them under general anesthesia with a anesthesiologist that comes in, and we can do like such a variety of procedures that we're not just limited to ones that we feel comfortable doing in a clinical setting. Mm-hmm. And so to be able to provide that service to the community was a huge plus for me. And I just, fell in love with the community within this office. Mm-hmm. Big green flags for me where people have been here and stayed here for like 25 plus years.
Yeah, big shout out to your implant coordinator.
Yeah.
She's been here for she said over 20 years, I think.
I think so, yeah.
Yeah, it's just amazing.
Yeah.
Yeah.
Everybody that I talk to, besides my team because they're new, and myself, they've been here at least 10, 15 plus years.
Wow.
Yeah. So it's
good culture.
Yes.
So what is the culture like if you work here?
The culture here is just everybody treats you like family. If something happens, it's no problem. Go take care of it. There's not even a question. Mm-hmm. And that's kind of how I like to, run my team too. If you have a problem, or if you got to go, or something comes up, there's not a question. Go handle it, because families comes first, and that's how you get treated here. I couldn't ask for much more. Yeah.
That's awesome. So it's been a great experience. You've been here for a year. What would you want other doctors to know about you that maybe are watching this, that are in the area, that maybe have never referred somebody to Florida Oral and Facial, or yourself?
I mean, just the level of care and compassion that we offer here is, I think, top notch. I pretty much call all of my patients that I've operated on at the end of the day, just to make sure they're doing okay. Ensure to them that if they have any problems, they give us a call. We get them in right away. Mm-hmm.
I mean, you are an extension of every general dentist that refers a patient to you. Mm-hmm. So the better their experience is, the better credibility you're mm-hmm. establishing with that general dentist. But also too, when that patient goes back to the general dentist, secretly you're hoping and wanting that patient to say, man, I had a great experience with Dr. Song. Those guys were fantastic.
Yeah. Yeah.
Mm-hmm. So what kind of procedures do you do the most of here in this office, you personally?
In this office, it's a lot of wisdom teeth extractions, bone grafting, mm-hmm. implant placements, and then I want to start building up my practice for orthodontic surgery.
So talk to us about that. It sounds like something you're passionate about. First of all, talk to us about what that is and what what you're excited, what you're trying to accomplish.
Yeah, so orthodontic surgery is correcting skeletal deformities. Essentially, if you have too prominent of a lower jaw or a retrognathic jaw, we're able to bring balance back to your face, bring it back to harmony. And also, the main objective of it is to get a good bite, regain an ideal occlusion.
Mm-hmm.
Because, some people, they just can't even bite into a sandwich.
Yeah.
Because their front teeth don't hit together.
I'm one of them.
Well, that's a different situation.
Okay.
But being able to do that for somebody is just, in my opinion, amazing. And it's really like one of the main surgeries that got me so interested in oral maxillofacial surgery.
So how many people in the general population, Jimmy? Water?
Yep. Thank you.
How many people in the general population would need your services for something like that? Because it doesn't really seem like something you hear a ton of, right?
It's not like a majority thing, or it's like, it's pretty rare. But if your skeletal discrepancy is just so far off where orthodontics alone can't fix your bite, then it's a surgical problem, and we're here to correct it.
So what is the name of the surgery for if you're like a class 3 underbite and we need to surgically remove some bone in order to get you to class? Yeah.
So a BSSO,
Mm-hmm.
a bilateral sagittal split osteotomy.
Are you doing cases like that here?
Yes, we do. I'm only 1 year out, so
Okay.
that type of practice it takes time to build.
Sure.
But one of the partners here, Dr. Pinker, he does them a lot, and I actually go in and cut with him.
Learn.
Yeah. Yeah, it's because orthodontic surgery, it's usually done with 2 surgeons.
Mm-hmm.
One surgeon cuts one side, the other surgeon cuts the other, and I kind of sit in with him and be a part of some of the surgical planning.
Which is super cool. Like
Yeah.
you're going above and beyond to learn to sit in, to continue to sharpen your skills, your crafts. Where do you want your career to go? Like, what do you want it to look like in 10, 20 years from now?
Oh man, I haven't really thought about it
See?
that far.
I got you.
Yeah,
Yep. We came up with some really good questions, some zingers.
yeah.
You never think about that? Like, man, what do I want to accomplish personally and professionally so that in 10 years from now, this is where I want to be?
Yeah, that is a good question, because I just feel like I've been go. I've just been taking it day by day, honestly. So, personally, my wife and I are trying to start a family.
Awesome.
So, maybe in 10 years having a couple kids.
Mm-hmm.
We're moving into a new house. So that's my main objective right now. But yeah, career-wise, hard to say, because I feel like I'm following it in some big shoes to fill with Dr. Akers, passing away so recently. But just continuing on the legacy of this practice, continuing to be a presence in the community, being a leader in the community.
What kind of stuff do you guys do in the community?
Our practice is a part of a nonprofit charity called Operation Changing Lives.
Okay.
So through that organization, we do some pro bono surgeries for people that are less fortunate.
Okay.
We also do a huge Christmas toy drive for kids in the community that are less fortunate. They put on golf tournaments for charity, 5K runs.
Yeah. So just kind of doing a lot of community outreach stuff.
Yeah.
That's awesome. I love doing stuff like that.
Yeah, a lot of our staff actually like are the people that kind of run it. They volunteer and go out and help out.
Yeah,
all that kind of
that's
stuff.
fun. I like that. So, I talk a lot about two things in practice. I talk about patient experience, and talk a lot about how you coach and develop your team.
Mm-hmm.
When you look at dental assistants, right? Like they're kind of like the backbone to to the surgical team in a lot of sense because they have so many responsibilities and things that they're doing. So when you joined this practice, and over the last 12 months, are there things that you see or things that you've implemented to help kind of develop your people?
Yeah, I would say like the biggest thing that I think helped my team out a lot was I essentially told them like when you're assisting me, you are the second surgeon. Think of yourself as the second surgeon. Don't think you're just there to hold suction or hold the retractor. Be there and be present, be involved, anticipate the next move, know the procedure, because I'm not perfect, neither is anybody else. You have to be there because we have to have each other's back. And so, that's a huge thing that I harped on is being present. Don't doze off or, look around or be there.
Yeah, like their job is so important. Like they need to know,
Yeah.
like you're not just, like to your point, standing here handing me instruments or holding suction. Like you are an integral part of this team.
Yeah.
Yeah, that's awesome.
Yeah.
Technology. We talked a little bit about technology when we started this off, but you've seen a lot of advances in technology, especially in the dental industry. When it comes to treatment planning and things like that, what's your experience been? Like, what are things that have made your life easier when it comes to some of these treatment planning companies and softwares and things that will kind of help to aid the workflow for different kinds of cases that you're doing? How has technology kind of impacted you in the last 12 months since joining this practice? Like Florida Oral Facial, when I think of companies, when I think of groups that invest in technology, you guys are the forefront of my mind. And the reason why I say that is because when I think of technology, it's more than just a piece of equipment. It's a piece of equipment that's being used with purpose. And when I look at your way out here and the fact that you guys have surgical suites, right? You have a setup that's unique. I also look at what you guys have done investing in technology with like the Yomi robot. There's not too many offices, not just like in Florida, but across the country, that have invested that kind of money into technology. And I know you said that you don't use the robot.
Well, I don't use it. I haven't had to use it yet, but I will reserve to using it like for cases where I have to be precise or it can be a detrimental consequence.
So what we're talking about is the Yomi robot, and what is it used for in practice? So people know that are watching this if they don't know what it is.
So the Yomi robot is a robotic arm that it's guided by essentially the 3D scan that's taken right before surgery. There's markers that are placed around the jaw or like on a bite block, and it literally guides you for precise placement of the implant. It tells you if you're 1 degree off, and it stops you at the exact length that you're planned at. So it's a really, really intricate machine. It's very cool, but for me, I think the biggest purpose of use for it for me is like if I don't have any bone to work with, right, and I have to like go into the pterygoid plates. Right behind that is the pterygoid plexus, and if you go into the pterygoid plexus, it's a bloody mess.
Mm-hmm.
And so, to precisely plan that and be able to place it exactly where I want, that's indispensable.
Yeah.
Yeah.
You're absolutely right. It's nice that you have that technological option
Mm-hmm.
at your disposal.
Mm-hmm. Yeah.
You think about like what is the best way I can take care of patients? It's by being able to use a multiple array of different technologies at my disposal if I want to, if I
Mhm.
need to. So that's a huge advantage as well. That's awesome.
Yeah.
Cool. So I'm thinking in the Daytona area, like when I think of Daytona, there's really like two things that stand out besides the beach. I think of the Daytona International Speedway,
Mm-hmm.
right? Have you been there?
Mm-hmm.
So what events have you seen there?
Been to the Rolex 24 there.
Okay.
And this was like back when I was in high school. I haven't been recently. And we've been to the Coke Zero 400.
Yeah.
And then I've also been to the Daytona 500 there too.
How was the experience going to Daytona 500 compared to those other events? Is it like
Well,
not even comparable?
the
Or
Daytona
are they all
500
crazy?
like the Daytona 500 is just the event of the
Yes.
year. It's amazing. I mean, to even have the president fly in for that event
I saw that.
is unreal.
Yeah.
So like it's hard to compare that against the other events. I would say my coolest experience at that racetrack was going to the Rolex 24.
Okay.
And it was nighttime, and one of my buddies, his cousin was on one of the teams, and he got me into the pits, and just watching like all the engineers.
I'm trying to pull this video up as you're saying it because I'm going right where you're talking about right now.
Mm-hmm.
So you're in the pits. Okay.
Yeah, you're in the pits, and I'm walking by, and I'm like literally just watching these like engineers yelling at each other in German, like taking specific measurements of each thread of each tire, and like seeing that much detail going into one car. That made me realize, like, okay, like this is where the sport is.
Yeah, I had no idea the fan experience that they've put together is unlike anything I've ever seen. So I have a good friend who is a dentist in Claremont, Florida, and he had a connection to somebody that was in NASCAR, and he had his car sponsored with the logo Claremont Lakes Dental Care
Oh, cool.
on the car, and we have like VIP access to the point that we were standing shoulder to shoulder with the guys that are on the race team working on the cars. Like, is this how close you were?
Yeah.
Insane.
Yeah.
Just an absolutely incredible experience. Yeah. So after the race, like, we were on the track. It was so cool. I haven't been able to get back there yet, but I would love to take my kids there just to experience it. We're not like big NASCAR people or anything, but I think going to a race like that and going through that experience, like I started following it.
Yeah. It shows you like the true nature of the sport itself.
Yeah.
It's not just a bunch of left turns. You know what I mean?
Yep.
Yeah.
Yep. The other thing I think of in Daytona is Buc-ee's.
Oh yeah.
So
Love Buc-ee's.
when I lived in Texas 100 years ago, I actually worked in a town called Lake Jackson.
Mm-hmm.
That's where Buc-ee's corporate office was. That's where they started.
Oh, I had no idea.
Yeah. Buc-ee's for the longest time was just in Texas only, and there's a couple of locations. So the fact that you have it here, they're building one, I think, like in Ocala, another
And-
monster. Yeah.
I had no idea.
How many times have you been there? Do you eat there? What do you do there?
I will grab a quick breakfast burrito from there. What is it called? Is it the Beast or something like that?
Yeah.
Yeah.
The one that's got you're talking about the one that has like the brisket, the
Everything
egg,
in
the
it.
potato,
Yeah.
the whole thing?
Yeah.
Yeah.
Yeah. I'll grab a burrito from there sometimes.
Mhm.
When my wife and I first moved here, we would go there and stock up on their fudge.
Yeah, they got really good fudge.
Yeah.
Mhm.
I love their fudge. Their key lime fudge is probably one of my favorites.
They have so many cool things. When you go in there, the next time you go in there, have you ever seen the bull skulls that have the giant horns?
Mhm.
And they're like, it looks like they took like crushed glass and they glued it all over the skull and it's got the horns. Man, I got that hanging in my house. People come over all the time. Wow, that thing's cool. I'm like, yep,
No
got that
way.
got that at the gas station. What? And then, do you like beef jerky?
Love beef jerky.
So when I had teeth, back when I had teeth, you never left Buc-ee's, ever left Buc-ee's without getting at minimum $30 beef jerky. Okay? I can't do that anymore.
Yeah.
So-
Soon. No?
Probably not going to be eating beef jerky with implant denture. I don't think that's going to hold up too well for longevity purposes.
Yeah.
Yeah. But it's all good. But Buc-ee's is a fantastic spot. Besides those two, you being the hometown hero, right? What are your spots? What are your local restaurant favorites?
One of our favorite spots is Chucherias.
Okay.
It's this small, they're reservation only. It's a very small restaurant, and it's in the old Holly Hill courthouse.
Mm-hmm.
And it's just one chef. She's this tiny little Honduran lady,
Mm-hmm.
and she makes some really, really good food.
Where is this place located at?
It's in Holly Hill.
Okay.
Yeah.
So how far is that from
Oh,
here?
probably like 15 minutes
Okay.
away from here. Yeah.
So that's your best kept secret?
Oh yeah.
That's the best kept secret?
Well, I don't know if it's a secret anymore, because anytime somebody asks me where they should go, I always tell them Chicherias. But it's really good. It's just can't get much better with fine dining.
This area has really expanded a lot. We've seen a lot more newer subdivisions, master plan communities popping up. You're seeing a lot more younger families moving to the area.
Mm-hmm.
When I think of oral surgeons, I think of dental implants.
Mm-hmm.
And I just did a quick search just because I was curious. And the population in Daytona Beach, as of 2023, 75,900.
Wow.
Okay, that's the population. And what I wanted to do was what percent of people could benefit from dental implants in this area specifically. And it says here that you're looking at roughly close to 20%
Wow.
of the aging population could benefit from dental implants. So I wanted to end the show by kind of talking about an unmet potential need in the community when it comes to restoring people's smiles.
Mm-hmm.
I talk a lot about function, stability, and quality of life. You being an oral surgeon and working here in the community and being from this community, what would be your message to somebody out there that maybe is missing a tooth or two, that isn't in any pain or discomfort, but maybe hasn't been to the dentist in a couple of years, and they want to learn more about what some of the options are out there for them? What would you say?
I would say first, establish yourself with a general dentist. Get a comprehensive evaluation, see what options there are for you to restore those spaces. And if implants strike your interest, ask to come get evaluated by me.
Mm-hmm.
We can see what we can work with, and you know, see if we can achieve that goal for you.
One of the cool things about technology is you'd be able to probably show somebody in the office what they will look like potentially after they had implants placed. Like you can physically show them like what that treatment plan looks like, right?
Yeah, we have models
Yeah.
of you know what an implant supported prosthesis is, what a single implant crown is, what an overdenture is.
Mm-hmm.
So we have those type of models to show them.
Mm-hmm.
But also I always pull up the x-ray in the room and kind of show them exactly where we're planning to place the implants, and you know, how much space we're working with,
Mm-hmm.
why I'm planning it this way, and usually, you know, they have a much better understanding of what's going on to themselves.
Sure.
And they feel a lot more comfortable going into the procedure. Nobody likes to feel lost when they're going into surgery, right?
Sure.
So I kind of, you know, I put myself in their shoes. I'm like, hey, if I were you, if I were sitting in that chair, how well would I want to understand this? And I kind of gauge that while we're talking.
This is the allergy.
Yeah.
Isn't it? This is what you're talking about? I think this is it. I think
The little
I'm getting it
tickle?
too. Yeah.
Stuff out. I have to blow my nose.
All right. So we're at 1 hour.
I felt
That was 1 hour.
like, yeah,
Felt like that. Felt like super fast, right?
yeah.
So, in closing, is there talked about some really good topics, good conversation today. Is there anything else that you want people to know about you as a doctor, as a person in the community, if you're seeing this?
I would say, you know, one thing I pride myself in is honesty. I'll be very honest with you. You know, if you don't need a surgery, I'm going to tell you.
Mm-hmm.
You know, sometimes the hardest thing to do is say no, but sometimes the hardest thing to do is do the right thing as well.
Mm-hmm. Absolutely.
And so that's what I take pride in. And you know, I'll say you'll never feel like you're pushed one way or the other.
Shouldn't be. That's not
Yeah.
what it's about.
Yeah.
Mm-hmm.
But you know, unfortunately, some people out there do,
Mm-hmm.
and you see it a lot.
Yeah.
But it's sad. It's sad.
Well, I appreciate you coming on the show. Great spending some time with you, getting to know you a little bit better. And if you are watching this and you live in the Daytona area and you're looking for an oral surgeon to partner with, if you're a general dentist, or if you just live in the community and you're looking for an oral surgeon, I highly recommend you check out Dr. Song at Florida Oral and Facial Surgical Associates. Thank you very much.
Thank you.
Awesome.
It was a pleasure.
I was down, but now I'm up. Yeah. This all got